You are listening to the Be a Better Being podcast, hosted by the founder of Better Beings, Michelle Zellner. Michelle's experiences have equipped her with knowledge and perspective, and for nearly 3 decades, she has been informing, influencing, and inspiring thousands on their journeys. This show spotlights guests of diverse backgrounds and areas of expertise, but they all align with Michelle's purpose and passion to help you be a better human being. There is something for everyone on their way to a healthier, happier life. Enjoy the show.
Greetings. Thank you for tuning into the Be a Better Being podcast. This is episode 147 being released on October 27th. It's officially Breast Cancer Awareness Month, and my last guest, Laura Hagen, shared her journey and perspective as she navigated her own breast cancer diagnosis, treatment, post-treatment procedures. So I thought it would be great to dive a little more into specifically cancer prevention in general, not just breast cancer, but thinking about how to explore a holistic approach through diagnosis, treatment, re-entry into, normal life. So I'm super excited for the conversation that I'm going to get to have with my guest, Jen Nolan. So with over 2 decades of experience in holistic and clinical nutrition, Jen is a passionate advocate for personalized root cause and metabolic-based care. Her work blends cutting-edge nutritional modalities with deep respect for the mental, emotional, and energetic aspects of healing, because true wellness happens on every level. She holds a BS in food science, human nutrition, and dietetics from Colorado State University, a master's in holistic nutrition, and multiple specialty certifications, including the Oncology Nutrition Consulting, Nutrition Genome Practitioner, and Metabolic Balance Coach. Her clinical work focuses on therapeutic ketogenic diets, autoimmune protocols, metabolic terrain balancing, and precision nutrition, utilizing genetic testing and various functional testing methods. Oh my goodness, Jen, thank you for coming on the show.
Thanks for having me. Excited.
Well, I'm excited as well. So I actually learned about you through a neighbor/friend of mine who has had a very long journey with cancer. And she shared with me that she was working with this practitioner. She's got this great protocol. She calls it remission nutrition. And I thought, wow, I want to know about that. When I read about what you do, I was like, oh yeah, we need to have this conversation. So before we get into all of that, I know I just read your bio, your credentials, but let's just talk about you as a person, kind of what led you to doing what you do, and then we'll get into all the good stuff.
Yeah. Me as a person. Well, I'm a Colorado girl. I grew up in Minnesota. I live in Colorado now. I've got a 23-year-old daughter who I work with or works with. We work together, which is awesome. And nutrition sort of came to me back in my early mid-20s. I was a city girl. I really didn't think much about it, to be honest. I grew up in the, 80s and 70s and 80s, and it wasn't a big part of my life, except for, I guess we had a garden growing up and I was an active kid, but my mom was diagnosed with cancer. She was diagnosed with breast cancer when she was 42 years old. So it was and she was only, 22 years older than me or 21 years older than me. So that sort of launched me into this discovery place where I just wanted to learn more about health and wellness, in particular nutrition. So that's kind of what launched me into that. That's when I went to get a degree in dietetics and food science. And then I moved on and went into more holistic nutrition, holistic health. And more recently, in the last, 8 years, I joined a group of folks and started to learn about oncology nutrition. And that's been amazing because it's just been this like full circle back to the reason why I got into it in the first place. And it feels like I may have said that to you before when we first met, but it feels like a way for me to honor my mom and our time together. And, I wish I would have known now what I wish I knew now, or I wish I knew then what I know now. Sorry about that. But you know what I'm saying? It would have been really nice to have this knowledge. And it just wasn't a thing then. She did do a lot of integrative care, which is cool. A lot of like more mental emotional work. She did acupuncture, Reiki therapy, those kinds of modalities. But the nutrition piece wasn't really a part of the conversation. So.
Yeah. And I would suspect that's because maybe back then they didn't really give so much importance to the role of nutrition and how that influences, every aspect of our health and how it contributes to disease. Is that why there just wasn't research on that? Or why do you think that is?
Well, it certainly wasn't a part of many trainings, right? And so that's huge. And honestly, in the more conventional space, like the dietetics space, there's still not much in the more holistic nutrition world. So it's still, I would call it a little bit old school still, what is being taught. And that makes me a little bit sad. But there's now I feel like we're really learning a lot about health and wellness outside of this sort of traditional establishments, right? So a lot of people are talking about metabolic health and wellness and prevention and all of that. And so that's pretty exciting to me. It's still, there's a lot of information out there. So the overwhelm is huge. We're in information overload. Mm-hmm. So now it's hard to know where to turn.
Yeah. And you and I did have an offline conversation, and I think we both agreed that it actually isn't that hard. It's go back to basics, right? Eat real food, which we'll get into that in a moment. I want to say one thing before we dive in, and to your point about kind of old school. So I had a relatively advanced and aggressive melanoma diagnosis a few years ago, and went through the oncology department here in Denver. I'm not going to say who my care physicians are, but at a, major network. Sitting in the treatment room, watching them feed cancer patients sugar. We know better. We do know better. We know that sugar, and maybe I'm wrong, sugar, very, very, very big driver of cancer. Is that correct?
Absolutely.
How do I know that? Mm-hmm. And that the oncology department of a major healthcare provider either doesn't know or doesn't care.
Right. Yeah, and I'd like to think they don't know.
I can't. How do I know that? I'm just some silly girl.
Well,
I don't have a medical degree. I didn't go to diet. I don't have anything. Literally nothing.
Well, and I think I just did a talk actually in Baltimore at this integrative cancer symposium, and the theme of my talk was what we eat matters, because there are so many people that not only do they get that messaging right there at the clinic and they get sugar handed to them, whether it's in the snacks or a candy bowl on the desk as they're coming and going, right? There are so many people that, I was like, give me a show of hands. Who has heard this statement before? Don't worry, eat whatever you want, just don't lose any weight when they're going in for treatment. And that is just so sad to me. It really hurts me. It hurts my heart and it frustrates me. I don't want to blame anybody. I don't want to blame the oncologist because they don't have nutrition training, which they don't. That's not their job. So instead, what about training, dietitians and the people who, or at least give them information that's correct, give their patients information, go talk to someone about this, because nutrition does matter. That's what frustrates me the most. It makes me really sad because people are so terrified of losing weight, and then they're just eating all this food that's really inflammatory and yes, full of sugar. That's a big part of it. But even some of the other food is so carbohydrate rich, mm-hmm. and that can be really inflammatory to the body. And, we'll get into this, but what cancer cells we know they love, sure, they might love sugar, but they also love an inflammatory body, an inflammatory environment. So if we can quell that, right, that inflammation, we can do some good work, I feel like.
Yeah. So let's just talk about some basics and basic terminology, because there might be some people who are not familiar. Talk about what you mean by metabolic health and metabolic disease.
Yeah. I feel like the sort of backbone of health, or the starting point of health, is determining if you have metabolic sort of imbalances in the body. Because if you don't, that is where a lot of diseases stem from. Right? So metabolic health means it means a lot of things, but it can mean that you're not on a sort of blood sugar roller coaster. So there's a lot of people that might be very like imbalanced in their energy throughout the day, right? So they need to take a nap, or they need to kind of graze throughout their day. They can't go without food. They can't fall asleep without food. They wake up super hungry, maybe even in the middle of the night. And in order to go back to sleep, they might need food. That's a sign of some metabolic dysfunction, maybe, right? Diabetes, middle body fat, right? Heart disease. All of these are indicators of metabolic dysfunction, if that makes sense. So what we want is we want to be able to, comfortably go from meal to meal, if possible. We aren't having tons of cravings for sugar, right? Because that's super addictive. And again, this blood sugar roller coaster that sugar puts us on. So when I think about metabolic health, I think of those things. Like we have balanced energy. We are at a good body weight, right? And there's all kinds of lifestyle things that we can do, not only food, to help us have metabolic health. So metabolic health or disease can lead to heart disease, obesity, diabetes, cancer, etc., etc. Does that make sense?
Yeah. What things, other than nutrition, obviously, like our systems are so integrated. Yeah. And I think we like to just look at what this one thing caused that thing. And it's almost never the way it goes, right?
Yeah.
So obviously we're going to talk a lot about nutrition, but what are some of the other things that have been kind of factoring into our increases of all of these metabolic disorders? Because that's been happening, right? These metabolic disorders have been increasing as a population, and I think also starting at younger and younger ages. So what are those things that are contributing to that?
Well, this is a really funny little story that I was having a conversation with my family and some friends, and someone said, he was like, what I think is really weird and interesting is that back in the day when kids got in trouble, they were told to go to their room. They're in trouble. Go to your room. Now, if they're in trouble, go outside. So going outside now is like a punishment for kids. So I thought that was really interesting and pretty telling of what's happening, right? Kids would far rather be in their bedrooms on a device now. And not everybody, of course, but that's pretty typical. So I think inactivity is, and you know this so well, right? This is a major component of metabolic health. If we are moving our bodies, we can better deal with our blood sugar. If we are building our muscles, we can better deal with our blood sugar. We are less inflamed. We are healthier overall. We're happier, right? We can sleep better. We can get rid of toxins better if we're moving our bodies. So if we are sedentary, like so many of us are, we are just letting all of these toxins and all the things pool up in our bodies. So that's huge.
Yeah, I mean, this listening audience knows I preach all the time. Movement is medicine, right? Head to toe, inside and out. There's some kind of movement that literally takes care of everything. There's not one kind of movement that takes care of everything, however. So ideally, we're moving every day and, we're figuring out how to address all the components. But I think it's even like, let's just start moving. Yeah. And I think what's happened, at least what I've seen over the course of my 29 years, is the people who are already invested in moving are moving more, but there's still this whole population that's not moving. So how do we, I don't know, maybe this is beyond the scope of this conversation, but what are, as you're working with people, what are some of those things that help people go from that I'm not doing anything to at least I'm doing something consistently?
Yeah. I mean, what I do in my practice is I meet every single person exactly where they are. So I really listen, lean in, hear them, see them, feel them, and really find out what they're capable of and where they, what kind of a person are they? Are they right? Are they an all or nothing? Or are they like, I just need to do little bits and little bits. So we always have to do that, right? Meet everyone where they are. And in our world too, if somebody's, got a lot of physical things that they're dealing with, like cancer treatment. It's different. It's not like, okay, let's go swing a kettlebell, right? Let's make sure you're going on a 10-minute walk with somebody, right? So you feel safe. So every single conversation is different, with movement always being part of it, right? What kind of movement can you do? We talk a lot about when folks are, they're super weak often, right? They're sick from going through the treatments and from being in a cancer journey. So what can we do? What can we do? Little, even push-ups against the wall, right? Anything we can do, the little tiny weights. So it's different for everyone. But what you said too about, it's never just one thing. I believe that with exercise, and I believe that with food, is diversity is so important. So, right, if we just do the exact same thing all the time, it's not going to help us as much as having the diverse food, but also the diversity in our movement.
Yeah, I think that's such a great point for everything, right? To not get bored, to not do some overuse, to keep challenging yourself, get over some plateaus, and to be able to address all the different things that different types of movement address. Let's shift gears specifically into working with maybe someone who's had a diagnosis of cancer, and how you would guide somebody through that with the testing, and how you then decide what should they eat, what shouldn't they eat, how do you work through that? Let's kind of go through. Let's take me. Let's say I came to you and said, Jen, I just got this diagnosis of stage 3B melanoma. It's pretty aggressive. I just had surgery. I'm going through immunotherapy. Help me.
Yeah. So again, every single person's going to be different. So we're not using protocols, but we're gathering information. So we start with these sort of assessments, right? And we have quite a bit of intake, just like a lot of people do, where we're really digging in to look at what we call the terrain. And so if anybody's interested, the book, The Metabolic Approach to Cancer, is a really incredible book that has helped so many people. And the founder of Remission Nutrition is a co-author with another colleague of mine, Dr. Nasha Winters. And they wrote the book together, and they go through what are called terrains, or what we would call terrains. So it's basically all the systems of the body. So things like blood sugar, hormone regulation, mental, emotional well-being, stress, and biorhythms. So looking at sleep and all of that. I may have said inflammation already, immune system, digestion, circulation. So there's 10 different areas we look at through these assessments. So through these intake forms, we can just use that. There's also on our website, we have a quiz that can be taken. It's a little lengthy. It's awesome, but that gives us kind of a window in to see, where are you? What does your terrain look like? And when I think about the terrain, I think about the soil, right? So we want our garden or our environment, our body, to be as healthy as possible, right? We're not treating cancer. We are looking at the health of the terrain and trying to boost that, because we know that if the terrain is in a better place, cancer is not. So cancer really likes a mess. So we're like cleaning up the house. Okay. So if cancer doesn't have all of these systems that are kind of have gone awry, like a super inflamed system or body, right? It's not going to be as happy. So it might be more sort of sensitive, say, to the treatment, right? Because it's not in this environment that it's going to thrive in. So that's kind of what we would do. We would look at this and kind of assess, like, what does your terrain look like? And then we might get the top 3. So what's really cool and interesting is that, say I have 3 different women, your same age, same exact diagnosis, they are all going to be very different. You go to standard of care, conventional care, and you get what is specific for that cancer. So what we look at is, what's your terrain and where are the imbalances and where can we help improve that, if that makes sense. So that's where we would start. So we also, of course, do a dietary intake. We look at how you're sleeping, how you're exercising, all of that. And we sort of start there. Every single person that comes to us is different. They're eating differently. we work virtually, so they're in a different state. They might have different foods available to them. So it's actually really, I love that part of it because it's so different every time. Everybody is in a different, maybe socioeconomic standpoint. They have different support. Some people are like, I can't cook. I can't shop. So we're looking for help there. So does that kind of answer the question?
Yeah, no, I think it's a fascinating approach, and it seems like the most common sense, logical approach because, yes, every person is different. Every body's different. Every system is different. All the things they're doing different. Even though they might have the same cancer, it's still different. And yet it is the one size fits all. Do this because this is what you have. And, that may or may not work for someone. It may or may not lead to, some of the side effects of treatment or maybe the outcome. I am curious, obviously the individual differences, but what about a different cancer? Let's say instead of melanoma, let's say I had breast cancer. So even though I'm the same and my terrain is the same, the cancers are very different. Yeah. So does that change the protocol?
It can, right? And so terrain is always first, right? And we do know, this is what I always say to folks, we know certain things about certain cancers and the way they might behave. We always still start with the terrain because we are not doctors and we're not treating, right? But when we know something about a certain cancer, say it's breast cancer, we have certain foods as medicine on the list, right? Like broccoli, microgreens every day could be an amazing addition as food as medicine. Prostate cancer, cooked tomatoes. If I can get folks with prostate cancer eating cooked tomatoes every day, and maybe it's in a tomato paste and a teaspoon, that's not going to hurt a single person, right? Make sure it's organic and put that into your diet because that can be really, really impactful, right? As food, as medicine. So there are certain things, and we also might look at a certain terrain a little bit differently, right? So if we know that this is a hormone driven cancer, breast cancer, right? We might really prioritize, even if somebody answered the terrain quiz a little bit different or our intake form, we're still going to look at their hormone balance terrain, right? And work on some things that can help balance hormones, but also how can we make sure that they're not being bombarded with what are called, these xenoestrogens or exogenous estrogens, and that's coming from the environment. So say I work with somebody who's been diagnosed with breast cancer, hormonally driven breast cancer, and they love candles, scented candles. That's going to be a flag for me because of those exogenous estrogens, those quote unquote naughty estrogens. We don't want those in the body. Okay.
Can you explain that? I know there's a whole bunch of people who have no idea what you mean by how can a candle give me estrogen? Right. I guarantee someone's like, this doesn't make any sense. So can you explain that part?
Yeah, for sure. So these are environmental components that are basically, they're called xenoestrogens. So they are, like I said, naughty, think dirty. Exogenous means from the outside of the body, right? So they're coming in, and we really, really want to minimize that because that can be very problematic with the whole body, right? With any kind of hormone balance or imbalance. And they can sort of drive a certain cancer, especially a breast cancer process, or, different ovarian cancers, right? Or prostate cancer, right? So watching what we put on our skin, what is in our environment, cleaning products, I'm so sorry, but like Bounce dryer sheets, things like that can be very problematic. I have a list of some of these ingredients and I can send you. There's also a really great resource for your listeners called ewg.org. And you can learn a lot about how to minimize toxin exposure. Okay. So remember, even if we're just talking about the terrain, right? And we're going, okay, toxicity is one of the terrains. So I'm going to assess by listening to you what your exposure is and has been in your life. And I'm going to ask you questions about your cleaning products. I'm going to ask you questions about your lotions, your face products, your hair care, laundry detergents, all those things, candles, scents, because that's going to give me information on where do we want to begin, right? How do we, and it's not scare tactics. It's not like all of a sudden everything's going to be perfect, but we start to peel away these things and get them out. And it's amazing what a difference it can make for your terrain, right?
Yeah, that's a great explanation. I know people hear the word estrogen and they simply think, well, that's just a female hormone.
Right.
They don't understand that plants have estrogens called phytoestrogens, right? It's a chemical compound. That's what it is. It's a chemical compound. And it's found in lots of different things.
Right. And there's also some, with phytoestrogens, these nutrients can actually be protective. So it gets a little bit confusing, right? So if they are xenoestrogens that are these sort of toxic, dirty estrogens, that's coming from plastics or scents and things like that. But if there's something that might be, and this can be a little bit controversial, but there are phytoestrogens that can come from plants. And genetically, some of us might need a little bit more than others of these potentially protective phytoestrogens. And that can come from, these foods, right? These plant sources like ground flaxseed or, soy. I don't use soy personally because it's a legume and it can be really tough on the digestion. Not to mention from my training, could also be pretty rich in glyphosate. Glyphosate, Roundup, which we do not want, that toxin. So it's a big conversation, but a lot of people are afraid of say flax. But what I tell people is if you have say an estrogen receptor coming off of a cell. This is my estrogen receptor. I have my hand, cupped sort of. And if you have a phytoestrogen or like a flax phytoestrogen, it can come in and land on this receptor and it can actually block that receptor. So other of the quote unquote naughty estrogens can't get in. So that can actually be a protective thing. With flax, especially since it's, we're talking about breast cancer a little bit. I love it too, because it can also be a sweeper in the digestive tract. So it can kind of just sweep things out, which is also really important, right? For toxins and getting rid of. I don't cook with it because flax isn't the most stable food in the world. I try to grind it as I go, put it in a little coffee grinder, grind it and sprinkle it on a salad or put it in something. I also don't love flaxseed oil personally because it's not that stable. So that oil turns pretty quickly. And then it becomes oxidated, and now it's not very good for our body. So
very complex, right?
Yeah.
I mean, that's the thing is I know people just want just make it simple. Well, sometimes things are just not simple. Yeah. Let me just ask, because I want to confirm for myself. Flax is a sweeper because of fiber, right? It's the fiber in the flax that is the sweeper, right? So listeners, PFF is your BFF. I'm always preaching fiber. Yeah. Get your fiber. Where do you get fiber from? You get fiber from plants. Yes. Plants and foods that come from plants. That's where you get fiber. So I always encourage people to have a minimum of 14 grams per 100 pounds of their body weight at minimum. Yeah. And I know people are nowhere close to that. Nowhere close.
When you said make it simple, keep it simple, I'll keep it simple. Eat real food.
Oh my gosh. You mean the thing Michelle says almost every single time? Yes, I know, right?
And so if you eat real food, that's a way to keep it simple. Right. And then there are all the nuances, the other things you can do. So if it's number one, what's the thing to do? It's get rid of sugar and processed foods, right? Processed foods, are all of those things that have been put in a box, put in a container. So if you can really start there, that can really help, right? I have a lot of clients that come to us. They get a cancer diagnosis and they go straight to a raw food diet. They go to juicing. They go vegan. And I see this happen often. And I always say, that's okay. You just got a really great cleanse. Now let's get started. Okay. Because I see a lot of people come to me sort of depleted. And when you asked about labs, we're not doctors, but from a functional nutrition perspective, I can learn a lot. If I have labs, it's not required, but it can be helpful. And we look at a lot more than just the standard sort of CBC, CMP. But if you eat real foods and don't juice the fiber out of it, that is going to do you a lot more good. So keep the fiber in. Don't just start juicing and eat raw. If somebody's going through a cancer journey and they're in treatment, eating raw food it's not that easy for the body. The body's working so hard. And now it has to work extra hard to try to digest all of that raw, right? You take juice in only, and now you're just going sugar shot, right? So we don't want that either. So I'm really all about balance as much as possible. And yes, fiber, please.
Yeah. So what about, the person, and this is maybe more to like the prevention, right? Maybe, well, I eat real food and I don't use household products and I don't burn candles and I still got cancer.
Mm-hmm. Yeah. Yeah.
So now what?
Right. So let's look at your whole terrain. Let's sort of look under the hood, you might say, right? Let's keep digging and let's find wherever we can. It's like being a private investigator in partnership, right? So we're discovering and exploring together. It's not always about food. It's not always about toxicity. Maybe you're someone who was really exposed to toxins early on. That could be. Maybe you're someone who has never been a good sleeper. And I'm not saying, oh, poor sleep causes cancer. No, but it can really disrupt the body. And cancer is like an opportunistic cell, right? So it's going to find whatever kind of weak place. We do look at genetics, although we know that cancer isn't exactly a genetic disease, right? We know that now, but there are still certain drivers in our genes that could set us up in a certain way. So I like to look at different, people's nutrition. I like to use Nutrition Genome as one of the companies. It's a saliva sample. And then we learn about their SNPs, those little hiccups in their genes. And we can kind of look at patterns and just learn certain things. It's never diagnostic or anything. It's not like, oh, it's your genes, but it can play a part. So I hear that a lot, actually. Like, I am the healthy one in my family. I'm the one that doesn't eat sugar, doesn't drink alcohol, and why me? And there can be a personality type too. So remember that, sort of mental, emotional well-being, stress, a lot of stress, high stress, different traumas. It's a lot of different things, or it can be, right? I always call it like the imperfect storm.
Yeah. Well, and I think that is where so many people get so frustrated because there are so many layers to all of it and everybody's different. I mean, people were like, oh, Michelle, how on earth did you get cancer? You're the healthy friend, right? But melanoma, like, number one, and this was after my diagnosis, I had done a genetic health profile. I had a guy on the podcast and I like to do these things for fun. And I didn't really look too closely at a lot of the results, but after my diagnosis, I went back, 68.6 or 68.8 increased risk for melanoma, genetics, me.
Wow.
Totally tracks. And then what did I do? Well, I grew up in the 80s where you bake in baby oil, you get as dark as you possibly can. Yeah. I went to school in Hawaii and I might have put on some sunblock, maybe SPF 4, right? But no, I was not mindful of that. Live in Colorado for 30 years. Yeah, I spent a lot of time outdoors. So the cumulative effect of exposure with my genetic predisposition for melanoma, and then you get melanoma. Like, that's how that happens. I think. Am I wrong? Is that not how that happens?
I mean, I think, again, it's very holistic. So it's like the imperfect storm, right? And sure, genetics can play a big part. I just don't think they're the cause, right? I don't think right? So what I would say is cancer, I believe, is a messenger, right? And now it's not now because this has been a few years, but like it's an opportunity to go, okay, what do I need to learn? Not how do I become super perfect and all of those things and be scared all the time, because cancer is scary. But what can I learn from this, and what can I discover? Right? How can I work on my nervous system? How can I, just make some little changes in my lifestyle habits, like you were talking about, right? What can I do to help my metabolic health? And we don't know what our metabolic health is necessarily sometimes. So this is where looking at, I love to look at various labs like our fasting insulin, looking at maybe somebody wears a continuous glucose monitor to see, are they on a blood sugar roller coaster? There's a bunch of people that appear to be super healthy athletes, and they're on a blood sugar roller coaster. How can we correct that? It's not always visible, right? So looking at fasting insulin, hemoglobin A1C, insulin-like growth factor, IGF-1, those are some of the numbers that we might look at if we can. Again, it's not required. So
I've done all that through Function Health.
Yeah.
I love that because it gives you all of that. And I'm fascinated at learning.
Yeah.
And I mean, it is, and I'm all of my numbers are like perfect, which is weird because, you think, well, you had cancer. So clearly something's wrong. Right. Yeah. And I think sometimes that's what we're trying to find, the thing. Mm-hmm. And I would love to be like, okay, it is that. So I can stop doing that. But when it's like, well, I don't know what it is, so I don't think I really need to stop doing that. And it's probably not that, so I'll keep doing that. And I think that is one of our own roadblocks, right? Because especially if it's like the thing that you really like doing, and if I don't really think that that's what's causing that, then I'm not going to give up the thing I like doing.
Yeah, it's true. Yeah. Sometimes it's not always about like what we have to give up either or change. And I often try, like if we were working together, I would be saying to you, bravo, thank goodness you've been so healthy, because this could have happened 20 years ago.
Right.
You are in remission. Bravo. You know what I'm saying? So it's really about pointing out the positives too, because all we do then is look for the bad, right? So that's part of it.
I think that's such a great point because, we like to create this alternative universe for ourselves where, well, if I'd only done this and this would have happened, or if I didn't do that, then this wouldn't have happened. You don't know that.
We don't know.
You don't know that.
Yeah. So it is complex. There's a lot of elements and it's very empowering. And the thing that I love about nutrition in particular is that it's something that people can do. Because when we get a cancer diagnosis, I don't know if this felt like this for you, but you're like, whoa, like I have no control over anything. Now I'm being told all the things I'm going to do. And with food, we can make those choices. It's a little bit tricky when somebody's undergoing treatment and they don't have an appetite. They don't want to smell. Everything smells bad. The taste is weird in their mouth. So we have a lot of we have a whole toolbox or several toolboxes of tips and tricks for side effect mitigation. So that can be really impactful for folks. But, it is nice because it is something that we get to do.
Well, and I think as the types of treatments are also evolving and developing new ones, I think that also might change. And for me, honestly, when I got the diagnosis, I was like, well, that sucks. Let's take care of it and let's get on with this. Like that's kind of how I approach things. I was irritated for sure.
Yeah.
But at the same time, I'm like, okay, well, what can I do? This is all I can do is get through it, get it done, keep living my life, adjust my relationship to the sun, be more mindful of sun exposure and the right kind of sunblock, and no more laying by the pool. Those days are over. No more let's go to the beach in Hawaii for hours on end. But it also doesn't mean I have to be a vampire and I can never go outside ever, right? But it is being very thoughtful about what the UV exposure is and continue living the healthy lifestyle that I've been living for 25 years.
That's it, right? Yeah. And make sure your vitamin D is in a good place.
Absolutely. And for me, that's through supplementation, because to try to get it through sun exposure is not wise.
Right.
Right.
And that is an interesting one too. Vitamin D is fascinating because a lot of us actually have these little hiccups or SNPs in our genetics where we don't do a very good job of converting it in our body. It's hard to get vitamin D from our food, right? Again, another reason why not to just eat vegan, because you're really not going to get vitamin D from your food. But I'm someone that needs to supplement as well. That's one of my everydayers. And I just have a maintenance dose. Everyone's a little bit different too. Like, I don't know what the guidelines on function health are, but when we look at functional lab markers or ranges, they're going to be a little bit different than what you might get at the doctor's office or from your lab core results. So that's always important too. It's making sure we want optimal health.
Right.
And this is important when we're talking about prevention, right? We're all in a place of prevention, right? And it's really important to know what the optimal levels are. So I have a pretty large lab run done. It's similar to Function Health. It might be a little bit different than that one. And I do that annually. I pay for it out of pocket because I just don't want to deal with insurance. And then I make sure, again, by looking at all these different areas, that my terrain is doing okay, right? And it gives me information. If one of my labs or two of my labs or three of my labs are wonky, then I have some information on what I need to do differently in my lifestyle and my diet.
Yeah. You and I have a very similar approach. And I teach a class called Know Your Numbers. And I talk about the recommended guideline, which is usually like, okay, this is the minimal so that you're not going to be in a critical deficient disease state. But let's try to be optimal. Let's be like protective and proactive and preventative instead of, okay, I hope I have enough to not get sick. Totally different, right? And again, usually that's going to be from a holistic functional med perspective, something who is more proactive versus our Western medicine that is disease care and very, very reactive. So I'm a big fan. And I know for a lot of people, the barrier to cost and paying out of it yourself, and that is a real barrier. And then I'm going to tell people you do the best you can. Yeah, and if your primary care won't run a vitamin D test, I bet if you asked, I bet they would at least get that base level. I think that's such a critical one that seems like it should be basic, because we do know, like, the medical community does know how important vitamin D levels are. That got very, very highlighted during COVID, in fact. So if anyone in the medical community still doesn't know that, then I'm going to double check why they're a doctor, and I'm not going to go to them for sure.
Agreed. Absolutely. On board. And I agree with you. Again, this is where meeting every single person where they are, because not everybody's going to be, even if they had, if they were able to pay it, they might find something else a priority, which is okay. Right. So ask your doctor, try that first always. If they'll add a few of those labs on. But vitamin D is a big one. And I think that more and more doctors are doing it. And then again, you just have to remember that just because the lab says you're okay, and if you're down at 30, you probably need some more vitamin D. I try to aim for 80. I don't know what you think about that number, but that's what I'm targeting. Yeah. Thank you. Yeah. The range is often 40 to 60. And I'm like, let's do 80. Because in this case, more is kind of better. I mean, it kind of is. Not always the case, but in this one it is. Agreed. And it really depends on where the lab is too, which is interesting. So you'll see in one state, one city, it's 30 to 60. Some it's 30 to 100. And you're like, what's going on? But it has to do with the average in the, certain, perimeter around the lab, which is crazy. Right. And most people that go in and get their labs drawn, or a lot of them, aren't well.
Well, right. And the client doesn't know that. I teach Know Your Numbers all the time. And they're like, well, I didn't have a red flag. And I'm like, so you're good just because you didn't have a red flag? And the lab, to your point, is who decides what those parameters are. And it's based on everybody around you that got tested around the same time. Yeah. That's it. It just means you're normal. You're just like everyone else. So I think even just that level of knowledge, right? That somebody hears us and was like, oh, well, then I better understand what that means and what do these numbers mean. That's why knowing your numbers, not just know them, but what do they mean? What do they mean? And why are they important? And what could you do to help get it to a better place. Like, this is about being a very active participant in your own health and learning about you and deciding that knowing some of this information could be super useful for either getting me out of a situation I'm in, or hopefully preventing me from getting into one, or for delaying the onset of something that I'm likely to get. And I mean, if we can delay the onset of it, well, great, because then we'll have less time on the other end to have to deal with it, right?
I agree. Yeah, it's knowledge, right? It's information. And it's not meant, again, the scare tactics. I feel like that's happening a lot right now in this information overload with all of the different, influencers, the social media. And it's great because it's bringing awareness, but it's also in some cases bringing fear, right? And I don't think that's productive. I think knowing your numbers because you want to be an active participant in your journey, whether you've got a cancer diagnosis, heart issues, whatever it is, or you just want to hopefully avoid it for as long as possible, right? And do the best we can. But we need that knowledge.
Yeah.
I'm a big proponent of that.
Yeah, I agree. My guest episode that's going to be airing right after you has this whole concept of a health philosophy. And she just wrote this great book called Health Shift. And it's really about empowering the person to determine what is your health philosophy. Are you someone who's just going to wait till there's a problem and then we'll worry about fixing it? Or are you someone who wants to know and then, okay, I'm just going to stick with like Western medicine. The doctor knows best. I'm going to do that. Or are you someone who is interested in exploring some of these alternative things? And are there supplements I can take? Are there alternative modalities for therapy I can take? Am I that person who wants to do everything she can to live the healthiest, happiest, most optimal version of her life she can do? And what is that going to entail? And I think when the person can determine that for themselves, that will also help them figure out how to approach and navigate through, especially when you get something like a cancer diagnosis, right?
Absolutely.
Yeah.
And again, everybody's different. And that's my first sort of, even before I've met with someone, I've looked through all of their intake and I can kind of know a little bit about their personality, right? After doing this a long time, you're like, oh, I kind of know who I'm going to go meet, And are they someone who's like, throw everything at it now? Let's get this thing out of here, get this, whatever it is, let's just go. And then there's some people that aren't, and that's okay too. I work with a naturopathic oncology doc, and I was in an appointment with her. We're sharing a client for me, patient for her. And she was like, look, you can either look at this as let's do this as a complementary or integrative approach, right? And we were talking about a bunch of the things with nutrition and supplements and all of that, and mistletoe therapy, which is something that's a really interesting integrative therapy that's used actually as a frontline treatment or a standard of care treatment in countries like Germany. So here in the US, it's not, but it's being studied quite a lot at MD Anderson. It's fascinating. So it would be an integrative therapy, right? So he has a stage 4 colorectal cancer and he's working with Mayo out of Arizona, and his doctors weren't overly supportive of anything else. No supplements. No, at least they didn't worry about the food. Like we could do whatever we wanted. This happened to be a dear friend of mine, but no mistletoe, no way. Don't mess with my treatment, right? And so she was like, look, the clinician was saying, this integrative doc or naturopathic doc was like, you can either do it now, or we can just get you through, get through treatment and we'll clean up after and use some of these things. So again, everybody's going to be different. He was not overly comfortable going head to head with his oncologist at Mayo. That's okay, right? My job is to sort of help coach people a little bit to have these conversations and really empower them to listen in and be their own, like find their own inner doctor. That's not always everybody. Okay. And that just, again, if you hear me saying this, it has to be okay. Wherever you're at is okay. Otherwise, it's too disruptive, right? We need to heal. And if you're so disruptive emotionally or disrupted, then healing can be a lot harder. Mm-hmm. So yeah, but mistletoe therapy is it's a cool integrative therapy. And I like to say integrative as opposed to alternative, right? Because it's not that we're like, don't do standard of care. There's a really good reason to do standard of care. Support your good, healthy cells while you're doing it, if you can, through food, lifestyle, meditation, all the things.
That's great. I think that's a really great note to end on, but I want to double check with you. Is there anything that you want to address that we have not covered before we sign off today?
That I can think of. I just am really passionate about being able to help people and just spread goodness and love. So I am not one of those, my way or the highway. A lot of people are. And I feel like that it's not productive. And I just want to really be with people on their journey and helping maybe guide a little bit and educate and empower. That's what it's all about.
I love that. This was such an enlightening conversation. Jen, thank you for coming on, and we'll put all your contact info. And if you send me that info on the book and some of the assessment tools, I think that'd be really great to have in the show notes, because I know people are going to be very curious to kind of dig into themselves and the things that, you've been talking about. So thank you so much for this conversation. And listeners, you know what you get to do. You get to go and be a better being.
Thank you for listening to the Be a Better Being podcast. We hope that what you heard today inspires you to embrace this journey of life with an open mind, a kind heart, and a willingness to learn and evolve. If you have a show topic idea or would like to be a guest, please visit betterbeings.net and fill out a contact form. Until next time, go and be a better being.